This is the injury report presented by NYU Langone Health. Yankees catcher Austin Wells was out of the starting lineup for a fourth straight game Wednesday because he's been dealing with arterial damage in one of the fingers in his left hand. So in today's injury report, we have Dr. Laith Jazrawi, Sports Orthopedic Surgeon at NYU Langone Health, to break down what exactly is going on with this dude's finger. Doc, thanks for hopping on with this, man. I feel like in the injury report, we've covered everything from head, shoulders, knees to toes, but we never talked about arterial damage. So what exactly is that? And why would that shut down a baseball player?
All right, Brandon, great being on the show. So I think the first thing to understand is, well, what's an artery? So arteries are basically tubes in your body that carry blood flow and blood to basically oxygenate or give nutrients to the tissue. Without arteries there, the tissue at any place in your body would die. Specifically fingers and digits and toes, the arteries end at some point. So at those points, there's potential for it to be cut off. So arterial damage in certain cases, like when in war injuries where an artery is cut, you can lose the leg below it. And you hear a lot of stories about that where there's gunshot wounds or whatever it is, a knifing where you cut an artery, you bleed out, you die, but you also lose the limb below it. Now, in this case, it's the catching hand where the ball is being thrown, in this case, 95, 100 miles an hour, and it's happening multiple times throughout the game. The gloves are great, but again, you're stopping a ball that's going 100 miles an hour right at your hand. So what does that do? Where's that impact going? Well, it's being distributed throughout the glove, but it's also getting the hand. And depending on how the glove is held, when I caught, I used to keep my index finger on the outside. I felt like I got more control of the glove, but that left that finger prone to some more damage. So what ends up happening is with the repetitive ball hitting, the finger gets injured, but also specifically the arteries can get injured. And what's happening in this case is that the arteries are probably spasming. So what's happening is the repeated pressure or force that's coming from the baseball is causing those arteries to spasm. What happens when something spasms? It constricts. When it constricts, the blood flow stops moving towards the end of the finger. What happens to that finger? It starts getting numb. Starts getting swollen, it starts getting bluish. That's what he was concerned about. And that's why he went through all these batteries of testing, because what else could it be? You want to make sure you're ruling out some sort of clot in the finger that can cause basically the finger to die, and also looking at potentially other things that can contribute to your finger getting blue or numbness in your finger. But in this case, there's a term for it, and the repeated injury to the finger can result in this thing called Raynaud's phenomenon. Raynaud is a condition, Raynaud syndrome, where the arteries, and in this case it's baseball, but in other people they have other medical conditions that can cause it, where the artery spasms and their fingers start to get numb, bluish, and start to hurt.
Dang, Doc, you really broke that thing down. I didn't know that you were a former catcher. We may have to get you behind the plate because the Yankees could use all the help that they can get right now. So what's the long-term effects that he's going to have to deal with when it comes to this injury, and how do they manage it going forward?
Yeah, I think his symptoms were mild, and he even alluded to that in some of the press clippings. The idea was making sure it wasn't something worse. And I think, peace of mind is very important for a lot of athletes as they focus on this. But the idea being that if you're having trouble feeling that finger throughout the game, there are many reasons that catchers are typically not the best hitters on the team. Though Thurman Munson, one of the past Yankee catchers, was outstanding, the idea is that they take a lot of abuse behind the plate. This is just another thing that leads to abuse, particularly of the hands. And imagine if you have a swollen index finger or one of your other fingers, or it's numb, and you're trying to hold a baseball bat, it's going to be hard. and that tactile feeling is diminished. So your hitting may suffer and go down. So that's the challenge. Now, are there treatments for it? Well, in significant, in cases where the symptoms are significant, there are medications that can be applied to the finger that increase the blood flow. There's also medications that can be taken that can decrease the spasming of the arteries in the finger to prevent this from happening. But again, it doesn't sound significant enough that he's going to take these meds because they all have side effects too. So the last thing you want to do is try to treat something and then have a side effect from that medication. But the idea, the question is whether, potentially a new glove, more padding on the finger, things like that, that will decrease the, sort of this barotrauma on the finger or whatever finger it is, to lessen the artery from spasming.
So let's say you had a patient come into your office and they're not a professional athlete. They're not Austin Wells. Is this something that's common that you see a lot? And how would you treat one of your patients as opposed to how the Yankees are going about treating Austin Wells?
Okay, so I think assuming it's not a professional athlete, then there's a whole differential diagnosis of what causes this type of condition, ranging from some sort of clot that's occurred in the upper extremity. So one of the things that we see in athletes is this thing called thoracic outlet syndrome, where the arteries to the arm, there's decreased blood flow secondary to throwing. Well, could the end result be some, finger issues that are going on and numbness? Of course. So in this workup, he had an arteriogram, basically, where they put a catheter probably through his groin area to light up all the vessels and send a dye through the vessels to see if there was any constriction anywhere along his vascular tree. And in this case, it was clear. But in a patient that comes into our office, there are several medical problems that can cause Raynaud's or arterial injury in the hands, ranging from autoimmune things, rheumatological things where your body is attacking itself, to something as simple as some sort of connective tissue disorder where you have a problem with your collagen in your body, and other medications that you may be taking. So as a physician in a non-athlete, or in this case, we know that one of the reasons for him to have it was this repetitive trauma, but you're still responsible to go through a workup to rule out other things. And the easiest thing to get to is to do an arteriogram, which is a fairly invasive test, but that gives you the answer in a majority of the cases to make sure it's not some sort of weird cancer, weird tumor, weird clot that's blocking the finger, because that requires surgery and something else to be done. But for the most part, Raynaud's, when you make that diagnosis, is you tackle the medical problem that's contributing to it. That can be medications, or in many cases, it's just an end result of the disease. And even if you control the disease process that's going on, patients will often live with some of the symptoms because it's not life-threatening. Some of the treatments for it, like nitroglycerin, where we wrap the finger in nitroglycerin to increase blood flow and stop spasming of the vessel, is used. There are also medications like calcium channel blockers that we use for heart patients that can be given that help control the spasming of the vessel as well. All these treatments, however, have side effects. So you really have to weigh the pros and cons of how you're going to treat the patient, or in this case, the athlete.
Love that, Doc. Thank you for breaking that down, man. You're a lot better than ChatGPT when I typed it in. Like, you broke that down a lot better than ChatGPT.
That's good.
Thanks, Doc. Thanks for your time.
All right. Have a great one.